So the congressional demographics, this is just a snapshot. It's probably a little tough to see, but featured in this, and we can share this and we'll make sure it's posted. If anybody wants additional information, we can provide that as well. So featured in this is basically the average age in the House and in the Senate, the percentage of women, the types of occupations, religion, etc. And that's just good for people to keep in their minds when they think about how we're impacted by policy and who's shaping it, because that really has a huge impact. Next, this slide goes even further. I know you can't really make the names out, but it goes over the specific names of women in the Senate, in the House, as well as the names of minorities, African Americans, Hispanics, and circled in red is the number of American Indians in Congress. And Congress are the appropriators, who decide and determine our level of funding. And so if we only have 2 there, I think we need to be creating a pipeline and keeping that in mind when it comes to youth, so that we can change that outcome for the future, because we all know there's no substitute for direct representation. Wanted to just include a dates to watch update. One of the things that we realize is that, while Indian country and the obligation the government has to us is just a piece of many issues that they're dealing with. And when it comes to trying to get legislation passed that are important to us, we have to realize when there are big bills that are getting debated or passed, because that's where you can get things tacked on. This is important to keep in mind when it comes to what the top 5 appropriations issues are. One of the things that's been occurring frequently is they're trying to tack on legislation to underride the ACA. So this is an issue that the president has said he will veto any attempts at that. So it's just good to keep a broad outlook when dealing with Congress. Republican control of the Senate will be tested in 2 years. This is just showing you what the 2016 Battleground looks like. It has a map of the states. And while everyone here probably heard that Congress, there's a majority Senate, there's a majority House, well, this coming election, 2016, which is a presidential election, there are going to be 24 Republican incumbents that have to defend their seats, while Democrats only have 10 at stake. So depending on who are the face of each party and the number of votes and the number of people that participate in the general election, that could completely switch control of the Senate. So if you can get out there, influence them, and say, hey, we matter, this is how many people that our program serves, these are how many tribal members in our community, that will really catch their attention, and they'll want to be attentive to you based on that. Just also in the same spirit of that, we've included some of the candidates that are looking to run for president. Next, we have the landmark Supreme Court case, King versus Burwell. This is probably going to be the biggest issue that relates to the Supreme Court and that branch of government. The issue is the challengers argue that the text of the Affordable Care Act only allows for subsidies on state-run exchanges, and that the regulation as implemented by the IRS providing for subsidies on state-run exchanges as well as federal exchanges exceeded the authority Congress granted to it. So it's based on a technicality, and if the Supreme Court decides in favor of King, 5 million Americans or more who obtained coverage through the Affordable Care Act federal exchanges could lose their tax credits and their health insurance coverage, and those effects would be wide-ranging and severe. And so that's an issue that Congress is supposedly preparing for, because if you're in a state where people have benefited from this, all of a sudden they're without it, well, not only is the person directly impacted going to be upset about this, but so are their family members, their friends, their coworkers, and the political consequences could be or will be really serious. And so they're looking at what they can do to fill in the gap or to deal with that if the Supreme Court decides against the administration. This year marks the 50th anniversary of Medicaid, and this has been a big benefit to seniors, peoples with disabilities, and low-income Americans of all ethnicities, especially American Indians and Alaska Natives. And when that was put in place, there was extreme opposition to it. So much so, I learned that doctors and the American Medical Association had doctors giving patients notes saying that if this law is passed, we will no longer be able to serve you next week. You're out of luck. You know, if you show up here to get help, we can't do anything if this law passes. And those are a lot of the same messages we heard after the ACA. So it's good to keep that in mind, looking toward the future, that, you know, we won't be having to fight as much, and that over time it will become more accepted, and you know, that we will be able to look back and see all the positive that it's done. So this is huge positive news for the state of Montana. The governor signed the Health and Economic Livelihood Partnership Act, and the bill the governor signs extends Medicaid coverage to an estimated 45,000 or more Montanans who previously didn't qualify, many of which are American Indian and Alaska Native. And a cool thing that I saw and read is that Earl Old Person, chief of the Blackfeet tribe, sang a victory song on the Capitol steps that morning, honoring the governor and lawmakers who passed the Medicaid expansion bill. And then I wanted to make sure to put in a plug for the president's initiative called Generation Indigenous. I was their president in Albuquerque because the National Indian Healthcare Outreach and Education Partners, NCUIH, NIHB, and NCUIH did an ACA training and enrollment event. Chance Rush was even there for the launch and facilitated an event with hundreds of youth. The HHS, IHS, Administration on American Indians, the White House Center for Native American Youth organized it and included representation from many Native orgs. And this is important to pay attention to for all of us because of the funding that the president has included in his budget that Congress will vote on, and that could increase funding for a lot of programs. He put a set aside in to increase MSPI and to create more programs for SAMHSA, and those are specifically targeted toward youth in behavioral health and mental health, and especially suicide prevention. Here's an overview of the stages of the process, and it's based on where we are now. So last Wednesday, the Tribal Budget Formulation Work Group co-chairs Andy Joseph from the NIHB at-large member and Gary Hayes presented the work group's FY 2017 tribal budget request for IHS to top budget officials at the Department of Health and Human Services. During the meeting, the leaders shared the recommendation to fully fund IHS at $29.96 billion. IHS is currently funded at $4.6 billion, and the key priorities that they laid out for the budget include hospitals, clinics, purchase referred care, dental services, mental health, alcohol, and substance abuse services. So where we are at now The next stage is they're going to have evaluation planning sessions in the weeks ahead, and they're going to be setting dates for the national meetings that follow. That's the overview of how it's broken up in terms of getting the budget together. And then here are the phases from a big picture outlook. So for how the budget comes together is it goes from the orgs and tribes to IHS, then IHS to HHS, then to the Office of Management and Budget, and then it gets presented to Congress, and so then that moves to testimony and hearings and meetings with various committees and members. And then once this is all voted on, it moves to the implementation side of the spectrum when the funding levels are determined. And then we go into stages of conferring, and the cycle repeats itself. So here's the makeup of the budget formulation work groups. Each area operates differently. You have 2 tribal representatives from each of the 12 IHS areas. Their co-chairs are selected at the national work session. Technical staff participate and support the area representatives. There are open meetings. National Indian organizations also participate at the discretion of the IHS director. Urban Indian health programs are present in 11 of the 12 regions. Each area chooses hot topics for highlighting, as well as their top 5 budget priorities. Examples of the priorities and topics are mental health, behavioral health, alcohol and substance abuse, dental, maintenance and improvement, incarceration alternatives, diabetes, suicide prevention initiatives. And in this last budget formulation national meeting, there are 6 areas where urbans were featured as hot topics and priorities. So to give you a sense of where things are in the budget formulation process, these budgets that are considered and approved are on a schedule that is, in looking basically a couple years out. So starting in the summer, last summer, that's when budget instructions, the meeting dates were shared. Then we went into, from October through December, that's when the budget area work sessions occurred. And that's all for 2017. So then through January, from January through this coming December of 2015, we're having the 2017 budget work sessions, HHS consultations, then it goes to OMB, and then in February of next year, the president will release his 2017 budget request, which will include the IHS recommendation that we've already put forth. And then next March through October, Congress works on the 2017 budget. So these timelines are projected far out, and tribal leaders have a lot of responsibility in looking toward the future now, in meetings that happen now and have happened and that will happen. And so this process, when we're laying out what our strategy should be for getting an increase, we have to realize that we're actually going to be looking mainly to 2018. So there's a lot that we can do now for the funding requests that have already been made and put forth for us. For instance, for the budget request that's in place for us now is a $15 million increase, but that was based on a request that has already been made. For 2016, it's a $10 million increase, or actually for 2017, what the tribes have put forth is a $10 million increase. So it's good to keep in mind that the work that we do now and from here forth actually isn't set to have the impact that we would want till further out. So it's a lot to wrap your mind around, but it's good to keep in mind that we're looking toward the future, and that this work is imperative now, but our strategy from here forward is extremely important. And the payoff isn't as soon as we would want it to be. I want to mention what the 2017 tribal budget recommendations are. To phase in full funding of IHS, total tribal needs of $29.9 billion over 12 years. I want to present a 22% increase in the overall IHS budget from FY 2017, the president's budget. Restore cuts and shortfalls and resulting from sequestration. And the area increases are divided by region, and the input that was put forth is for this budget was shared by the area representatives. The co-chairs, we had mentioned there's 2 co-chairs from each region, and that's how this came together. Also, they want to provide additional $300 million to implement provisions that were authorized in IHCIA, support the president's proposal to reclassify contract support costs from discretionary to the mandatory appropriations, and to be reauthorized every 3 years, request a higher percentage budget increase in the hospital and clinics budget line item to allow flexible service expansion funding, which can be used to fund local budget priorities. To focus on what NCUIH is putting forth as a funding increase strategy, we're recommending that we increase our attendance at the regional meetings and assign representatives as well as alternates for each of those regions. And remember, we're in 11 of the 12 regions. The support for urbans is more than others. We'd like to see our programs increase attendance and representation at regional tribal conferences and build tribal leader support, because there's a lot of advisory committees and even these national committees where we don't have a formal seat at the table. So we really need to increase support from the tribes. And they do, and many are. There's improvement happening in that. Also, we want to get on the area priorities list for each region, and at a minimum have programs request $2 million for the urban line item per area. And in total, and there are programs that can and do get a larger increase set aside. But you also want to ensure that when you make that a priority in your area, that word goes forth when they're representing you in DC. You know, the 2 co-chairs from each region, you want to make sure that message gets taken to DC, because it will also be listed, but there's those 5 hot topics and budget priorities, and if we can get at least on number 5 on their list, then in aggregate they look at what are constant themes that come up, what is a budget priority for each area, and so they look at that across the board. And if we're listed as number 5 for many areas, and we have all these areas requesting an increase for the urban line item, they put all that together, and then that will significantly boost support for us from tribes as a whole within the IHS budget request. And then the next stage is for urban Indian health programs to gather numbers on tribal members served by the programs, and citing the number of American Indians served by a code, and then sending that information over to tribes and the IHS service area, so that people start to get a better picture that we're not just serving urbans, we're serving tribal members. And the more we remind people that we're serving your tribal members, the more support we will get as a whole and from the tribal leaders in our regions. I want to focus on some of the information that's in the packets that you have. We want to increase our representation and education on Capitol Hill. We have bipartisan support on key committees. IHS has seen increases throughout this administration, aside from sequestration, which is still a possibility, and historic shortfalls. So we have a lot to make up for. And to secure additional resources for the urban Indian line item, we need a lot more policymaker education. So outreach must be strengthened and sustained. NCUIH wants to improve our service to the membership and coordinate effective education strategies. So we've put information together in your packets. You'll see how to talk to Congress packet. You'll see a Urban Indians 101 flyer. You should see a guide on scheduling site visits with members of Congress. You should see membership profiles. So who is your elected representative? We tried to make sure if they were in Congress that we listed, did they vote for the Affordable Care Act or against? So you know who you're talking to. If there's things in their background that you have in common, if you meet with them and it shows that they played a certain sport and you have somebody on your staff that you could bring with you if you were to meet with them, you know, those little things go a long way. If you went to the same college. So we just tried to use the resources available to us to provide you a fuller picture of their background so that you're as informed as can be when you would reach out and work with them. And we want to improve that information. We also included key committees for urban Indian programs, so you're aware of, you know, who sits on the committees and what those committees are. Legislative priorities, where we are. In general, progress is very limited with this new Congress and the stalemate between them and the administration. Advanced appropriations has been introduced by Republican Senator Murkowski of Alaska. She's had some staff turnover, so it will likely take some time to see any movement on that. Sequestration is still an option. We'll closely track and update membership on that. There's 2 IHS student loan reimbursement bills that have been introduced, one in the House, one in the Senate, and those have 41 co-sponsors. So if that's an issue that's important for you and your programs when it comes to recruitment and or retention, we can get you more information if you wanted to reach out to your member on that. And that would help, because if we can include the number of co-sponsors in Congress, then that will build more support for it and help with its consideration. As you heard, we sent out an update that special diabetes programs for Indians was renewed for 2 years as part of, it was tacked on to what was called the doc fix. So we'll have to refight that fight, and we should get started again soon and you know, push for multi-year renewal, 3 years, 4 years. And of course, what we'll always do is put at the first and forefront that NCUIH and urban Indian programs are for full funding of IHS, as all tribes request, so that we're on the same page and we know that we benefit from that all. And that's something that we will continue to emphasize. So we just wanted to give some examples of technical assistance support that we can provide at NCUIH on a local level if needed. For instance, I've been working with Del Nutter. He has a congresswoman in his district that represents their program in Denver who has a child that is affected by diabetes, and so she's introduced a bill centered around diabetes, and has asked to have her press conference announcing her introduction of this bill at his Urban Indian program. And so we're working with them, and we're working with NIHB to provide them more statistics, good talking points, just to be as supportive as we can, even from a distance. So if there's ever anything we can do for you, you let me know. I'll have my contact info on the next page. If you want to write a letter or send an email or make a call, I can help you track down who the staffer is back in your district, or if you're coming out to Washington, D.C. and you want to meet with the office, senator's office, or your member of Congress, your representative's office, I can help get that meeting. So you let us know, and we'll do everything that we can to help. And so that's my contact information, and want to hear any questions, concerns, feedback. Thank you.